How is everybody tonight? In the blizzard.
This is Pat Agee. I'm 217-840-0859. I can't figure out how to get through a link, so I just want to let you know.
Thank you. Thank you
Okay,
so
thanks,
much,
thanks, Pat.
That will help us. That will help us so much with correct attendance. So that's Pat Agee from Cunningham. And if folks
I'll
don't mind,
get in. Okay.
what's that?
I'll still get it.
Okay. So yeah, if folks don't mind signing into the chat, that helps us to get your name spelled correctly and your correct agency affiliation if you have one. And after more people are here, I'll put a link to the full board packet into the chat too. And I'm at the Shields Carter room to keep us legal,
Keep us compliant.
keeping us legal. I don't know how much longer this will work, but it's nice on a snowy night. It's nice.
I agree. Just stay in my office till it's time for me to go home.
Okay, here's John, but there's still not a quorum.
No, that's just 3 of us
Here's Molly.
right now. Okay, 4.
Getting there.
Getting
Yeah.
close.
Just one more. John, I heard a very small child coughing in the hallway today. I almost called you. I was like, ah, something's wrong.
I think we're back to normal winters, unfortunately. It's gonna be a rough winter. It already has been a rough winter. Yeah, just all kinds of viruses going around right now.
Yeah, RSV and flu, and then we got COVID too. So
Well,
the viruses are running amok.
Oh yeah, a lot of other cold viruses though too.
Jane's here, so I think we
And
Matt, so we're good.
Okay, we're all right.
Oh, all right. Okay, I'm gonna mute myself. Go for it, John.
I will call the November 16, 2022 Champaign County Mental Health Champaign County Mental Health Board meeting to order. Can we have a roll call, please?
Matt Hausman.
Here.
Daphne Maurer. Alexa McCoy. Molly McClay.
Here.
Joe Omo-Osagie.
Here.
Elaine Palencia.
Here.
Kyle Patterson. Jane Sprandel.
Here.
John Paul Joachim.
Here. All right. The next item on the agenda is the approval of the agenda. Do I have a motion to approve the agenda?
I so move.
Do I hear a second?
I will second.
All right. Roll call.
Molly McClay.
Yes.
Joe Omo-Osagie.
Yes.
Elaine Palencia.
Yes.
Jane Sprandel.
Yes.
Matt Hausman.
Yes.
John Paul Joachim.
Yes. Next item is the citizen input. We'll reserve individual participation to 5 minutes and limit the total time to 20 minutes. So if there's anyone in the meeting that would like to speak, now is the time. I think I see Darlene Kleppel's hand raised.
Yes, I would like to just say a couple things. I am completing my term as the county executive. And as you know, I've appointed many of you to these positions. So I've been watching how you're doing your jobs. I'm very pleased with how it's working. And I know that you have some tough decisions to make. And you guys have spent a lot of time doing a better analysis as the years have gone on. You guys have done a much better job actually evaluating all the programs, and we've gotten more and more programs, which means there's a little more evaluation that needs to take place. So I realize how much time that takes, and I really appreciate the fact that you guys give that good effort. And I also want to just say goodbye to the staff at this point. It's been a while since I've seen some of you, because I know a lot of you are working out of the office, and I appreciate the time and effort you guys put into your work as well. I know you're very committed to these programs. So that's all. I just wanted to say goodbye and good luck in the future. And I'm heading off into the sunset, as you can see.
Thank you, Darlene. Is there anyone else that would like to make any comments?
Yes, my name is Jeffrey Scott. I'm with Immigrant Services Champaign Urbana. This is my first time attending the meeting. I'd like to be added to the group so that I can attend future meetings. And I just wanted to say I'm glad to be here with you all. I'm the social worker that was recently hired. So we're hitting the ground running.
Awesome, thank you for that. Are there any other comments? All right, seeing none, we'll move on to the president's comments. I'll just keep it short. Basically, we have a pretty long agenda today, so we'll try to move through quickly. I think we do have the selection of the board member to serve on the RFP review team, so we will talk about that later. But a lot of stuff today is, we'll try to get a lot of it done so that we don't have to have a meeting in December, but we'll talk about that as we get through the meeting. All right, we'll move on to the executive director's comments. Lynn?
Hi. There is a lot, and this is it's not only an action-packed meeting with lots of things for you to review and approve, but there's also a really great presentation. I expect it to be great. So I think I will defer. If we get through the approvals today, you might not need a December meeting. Some things could happen between now and early December, which would change that, but that's something for you all to think about, and we can, when we get to the schedules, we can discuss.
All right, the next item is the approval for the CCMHB minutes from October 19th, 2022 board meeting, and then the October 26th, 2022 joint study session. So I'll give people a moment to look over that, and then if there's any questions or addendums that people want to make, speak now, and then we'll make action to approve the minutes after.
If there's no discussion, I make a motion to approve the minutes from the 10/19 and the 10/26 meetings as presented.
If I hear a
Second
second.
that.
All right, well,
Yes.
I'll have a roll call.
Molly McCoy,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
John Paul Joachim,
Yes. And then I see Kyle is here. So it looks like he just joined the meeting.
Kyle just joined.
Yeah, I think I saw him on the chat or on the list.
Kyle also.
Yes.
All right, so the next item is the vendor invoice list.
I have a question about an item on page 13 of your packet. MTF Business Solutions Accounting Coaching Support. What is that for agencies or what is that?
It is. I'm not sure if he wants to speak to it, but Chris Wilson has worked most closely with this person. She's consulting with agencies to
Okay.
help them maintain their financial records in an audit-ready state.
Well, good. I know we had talked about that, the need for that. Is that going to be ongoing or one-time thing?
It's not one time. I think that we termed it, I don't have it in front of me, but I think we termed it to June 30th. And, we would ask you for approval for a continuation. I think that's right. And I could check.
Okay, well, yeah, okay,
It's not super long term.
okay. So we'll be talking about it later anyway. Okay, that's what you're saying. Okay, thank you.
All right. Do we have a motion to approve the minutes? Or sorry, motion to approve the vendor list? Sorry.
I can make that motion to approve the vendor invoice list.
Oh, go ahead.
I'll second.
Can we have a roll call, please?
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
Molly McClay,
Yes.
John Paul Joachim.
Yes. So the next item is new business. So I have a presentation on the Coalition Summer Youth Initiatives with Tracy Parsons and Sam Banks.
Lynn is pulling up our.
You ready? You ready for?
Yes, I am.
All right. This is gonna be, I'm so stressed. A test of my dexterity. Here we go.
Well, thanks for helping me with my stress by doing this, Lynn, so thank you. So I know my colleague and partner in this, Sam Banks, was doing some traveling. So Sam, I'm not sure if you've made it on. Okay, so I'll handle this on behalf of our project and our work together. And I saw a couple of new faces and names. So just in case you're not familiar with our Champaign County Community Coalition, the 30-second elevator speech is the Community Coalition is an entity that's in our community that brings government, law enforcement, our education systems, our parks, our funders, the Champaign County Mental Health Board and the United Way, along with the Housing Authority and the Regional Planning Commission. We've all come together to work on our community's most difficult social and economic issues. And we do that in the areas of community engagement, addressing police community relations, youth development. Community violence has risen to its own level of priority. And then we have an area we call mutual advocacy, where we support common community issues. So I always like to use the issue of the homeless. And so we don't want to do work around the homeless. There's a number of community groups already doing that. So we want to support that, those agencies' work and support our community's needs around that. So I must always start off and just thank the Mental Health Board for your support, continued support for our summer initiatives. This continues to be one of the most impactful initiatives and projects that we take on through the Community Coalition and as a community. So just structurally how it works, the Don Moria Boys and Girls Club receives a contract and an agreement with the Mental Health Board to administer and manage our summer initiatives. Each contractor submits a proposal annually to talk about their programs and activities. And then through our executive committee, which is representatives of all of the groups that I mentioned to you before, talks through and approves the activities that we do through the summer. Next slide, please, Lynn. So again, the Boys and Girls Club convenes all of our subcontractors at the beginning of the summer. They talk about contracts and requirements, go through the monitoring and the budget and the spending, puts together all the contracts, the documents, collects the data from each one of the subcontractors to submit that information to the Champaign County Mental Health Board. Next slide, please. So we have really fine-tuned our work over the last few years and each summer to look at doing programs and services and supports around arts and culture, recreation, academic enrichment, leadership, and community engagement. So as you all are aware, we are still returning and recovering from COVID. So the previous 2 summers before this year, we were doing things virtually. Our community partners and agencies were phenomenal going through the pandemic, adjusting, learning how to do virtual programming and engagement activities. And then so this summer we were fully back in place. So as a community, as we all are still looking at and addressing and recovering from the trauma, being trauma informed as a community, to look at and respond and recover from the pandemic. There's also been an influx of resources, primarily through the American Rescue Funds that were afforded to our community, which includes the cities, both cities, Champaign, Urbana, and then the county itself. So those initiatives have started, are underway, and resources are also coming into our community to help address and support agencies, organizations, individuals, families, and neighborhoods from the pandemic. So the city of Champaign has implemented something we call our blueprint to address our community violence issue. So a lot of the work that we were doing through the coalition has transferred in Champaign to go through the blueprint. So I wanted to share that with the board as we are working with our community partners, building collaborative approaches to address our community's most difficult social and economic issues. Next slide, please, Lynn. All right, so this summer, we really had some first-year initiatives that I'm extremely proud of and really want to just share with the board our work we were able to do this summer. So one of them is a project that we called Raw Tools. This initiative was primarily organized and coordinated through our faith community. So we have the Ministerial Alliance and the Interfaith Alliance, which is comprised of religious organizations across faiths and beliefs and all those types of things. So we did this Raw Tools project. We found a group out of Colorado that looks at using tools, guns, that we melt down and turn into garden tools or proactive, positive tools to complete and do community engagement. And so what makes this a partnership work and was wonderful is, again, we worked primarily through our faith community. We had an event out in one of our parks and had great participation around this Raw Tools initiative. Again, looking at how we bring and partner with our faith communities to address our community's gun violence issue. Another first year project that I wanted to share with you is something called Love Circles. We have a local entrepreneur, Heather Rose. She really focuses on women's health, self-care. And so to be able to support this work was very, very positive and very impactful this summer to look at, again, individual needs, specific needs of women and talking about self-care and maintenance and to do this through an entrepreneur was really a very, very positive initiative this summer. We partnered with the That's What She Said group, first time partnership. They did specific program for females and did a number of programming activities that young ladies would go through. They received a certification. They went through classes, and just a phenomenal partnership. Look forward to working with that group again. We had something in the arts area that we call jam sessions. So we partnered with Champaign Library, and we created a space for artists, musicians, spoken word artists to come together on Fridays to just have an open session for individuals and artists to come together. Phenomenal experience. I'm talking with the library now because we want to really continue that initiative and that work. And so just really pleased to get jam sessions in place. And then my favorite, I've just really become a fan of this next gentleman. So early in the summer, I met a gentleman who's recently released from prison. And what he learned and taught that made the difference for him was learning about yoga, right? And when he first approached me, I said, yoga, trying to figure out how it worked. And really, as he talked to me about mindfulness and all of those things that, again, formerly incarcerated individuals are addressing and learning about and dealing with, it was a fantastic experience. So what we were able to do was get Mr. Hunter certified. He's now a certified yoga instructor. And so you listen out for Hunter Boy Fitness, look good, feel great, and stay healthy, as we're going to be doing yoga throughout the community, working with our formerly incarcerated populations. I'm really hoping that the park districts will create a space where he can practice yoga and be involved in community wellness, mindfulness activities across our community. I forgot to say slides a couple times, Lynn. So the first one, yeah, this is our That's What She Said group in their meeting sessions. Jerry's certification I put there. So you can see that he's now certified yoga instructor. And the next slide, please, Lynn, is again, the young ladies that participated in the That's What She Said and took college tours. They spent some time at the credit union and really was a fantastic initiative this summer. Next slide, please, Lynn. So again, we like to always share with you the data that really highlights the amount of activity that we were able to do this summer. So 59 youth participated in work program related activities, peer support groups, activities at Krannert Center for Performing Arts, again, promoting and encouraging the arts and art exploration. Rantoul work, we're able to intentionally do some work out there again and put that focus in place. We continue to work with Reverend Comer and his expansion of what he's doing for youth through Midnight Basketball is just phenomenal. And so again, STEAM activities for young people, direct programming for females and males, really just continues to be a highlight of our activities. So I just quickly wanted to run through that for you and with you to just see the overall impact we continue to have during our summers. Next slide, please. So again, community engagement, thinking about how we bring our community back together coming out of COVID. Record year of gun violence in our community last year, getting people reacclimated to interacting with one another. So to be able to be very intentional with our young people, as you see, we were able to get young people just out having fun, being involved in the community with recreational activities, arts activities, just really, really, really good stuff. Next slide, please. So again, we often talk about and think about our youth, which is really important, but we also are able to do some social networking and create opportunities for professional African-American communities who often just need the socialization, the ability to come together as a group, as a community. I think we don't often realize as a community how isolating it can be for many African Americans in our community who are often one of only a handful working in their organizations and their businesses. So to be able to create these positive exchange places have become very, very important for us in retaining and keeping our African American professionals in the community. So I wanted to just highlight that we've been able to be consistent and do those activities as well. Next slide, please. Okay, so I don't know how much of the data you have seen about the impact of COVID on African American students and youth in our schools. The data is devastating. And I must say that again, the data is devastating on the impact COVID had on Black children in our schools. So our ability to do academic enrichment and leadership activities in the summer becomes even more and more important to support and supplement what's happening in the school year. So we were able to do, again, a great deal of academic enrichment, include that in a lot of the programming that we're doing. So while we're doing fun things, we've got to spend some time on reading, math, and arithmetic, and all of those really, really important things. So I wanted to just keep that on the board's mind and share with the group that we're very intentional about academic support through the summer. Next slide, please. So again, we've continued to have just great experiences for our youth. We were able to take a group up to the Chicago White Sox for a game, bus experience, lunch up in the city, just phenomenal experience. We were able to take a group of students down to Memphis, Tennessee for a cultural experience and college tours this summer. So arts and culture, again, combining that with academics is just a really, really important part of the work that we do through our summer initiatives. Next slide, please. And then finally is just sharing with the board the work experience activities that we're able to do each summer across Champaign, Urbana, Rantoul, and the county. These pictures here are the youth that we had working up in Rantoul, and great group of students. Regina Kreider just does a phenomenal job up there in the summer with engaging students and creating community projects. I was able to go up to their end of the year program this year and meet some of the parents and the youth themselves. And I just had one of the parents come up, she had tears in her eyes and wanted to give me a hug and just say thank you for this work for the summer. And the $300 check that her daughter was going to have from participating was just going to make a difference for their family and how much was helping their family. And I think sometimes we take those things for granted. or we don't realize how these meaningful opportunities during the summer can be a difference maker for our families who need as much help and support as possible. So I just really wanted to share with the board that experience. And I felt like a rock star that day with the kids and the families who just were very, very, very appreciative for this opportunity they had this summer. So that's kind of the quick and dirty of the presentation. The coalition meets the second Wednesday of each month at the Holiday Inn, 3:30 to 5 p.m. It's a great, great community meeting. We have about 100 in attendance each month from all across our community, looking to work together, build partnerships, and address our community's most difficult social and economic issues. So I can't thank the board enough, the mental health board. I was just abbreviate it and say the board, but really this work and this partnership is so impactful, much more than the 600 folks that I mentioned that participated this summer. What we're able to do through our partnership and our collaboration to make a difference is really important. So just thank you so much to the board for the opportunity each year and continuing to support this work. Then I don't know if you want me taking questions, I can if any of the members have any for me, but thanks for allowing us to come and share this energizing and exciting work that we do together.
Just want to say thank you, Tracy. I know how much effort you put into the Champaign Community Coalition and all the work you do in the community. And I know it's a whole team effort that goes into everything you guys do. And I know the community really benefits from everything. So thank you. And
thank you, sir.
And the Don Moyer Boys and Girls Club as well.
Well, it's a phenomenal partnership, and we've just really worked hard over the years to be as impactful as we can. And I think we're doing that in good, creative ways. So thank you. All right.
All right. Any questions?
Just another thank you, Tracy, for all you're doing. But I would be remiss if I didn't raise one concern, and I think Dr. Joachim, seeing what he's wearing, would agree with me. I am slightly concerned that it went to a White Sox game and not a Cubs game, but.
Well, we need help getting those Cubs tickets. The White Sox are readily donating the tickets for us.
Fair enough.
Pay an arm and a leg to get the Cubs tickets.
The one to watch really with Tracy Parsons is that Northwestern and Illinois game coming up. Am I right?
I just
Thank you.
also
Thank
want to
you.
say, oh, I'm so sorry.
No, go
I
ahead,
want
Molly.
to
I'm
say
sorry.
thank you as well. I'm newer to the board, so really getting to hear this presentation and hear about all of the different initiatives that you have had it was really cool to learn about all of that, and especially seeing how much arts focused and physical activity focused. I know a lot of times when we think about mental health services, we're thinking about talking to people in individual and group settings, but I know that there's so much mental health benefit that can come from engaging with the arts, engaging with our bodies, and it's seeing like things like the jam sessions, which as a music person myself, I loved, and the teaching the yoga, and like that's just very awesome to hear. And I know there's sort of more and more research coming out about the mental health benefits of these things. And I'm really glad to see how much of this is present in our community and the work that you've done to make that happen. So thank you.
Well, it's all of us together. Thank you for the comment. Yeah.
And I think the only thing I'd add to that is, it's great to have these opportunities, but it's also important to make sure that people are able to access them and get to them. And you guys really do that and make sure a lot of kids are involved in these things. And so thank you for that, because that's always a big obstacle. And you're
Well,
able
the other part of this that I always love to share with the board is that this allows us to work with those individuals, those groups, those church groups that are not the Boys and Girls Club or the Y, or some of those really big organizations that have a lot of support. So you think about a person who's done his time, learned about yoga, can talk about what difference that can make with the formerly incarcerated population of our community, and to now be able to empower him to work with that population on mindfulness and all the benefits that you all know that comes from yoga coming together, community coming together. And that's a unique thing. So I just can't say thank you enough for helping us with the flexibility and the uniqueness to do this work.
All right. Well, thank you very much, Tracy. All right. So the next item on the agenda is the registration application reporting system changes.
Oh my gosh. This is horrible. No one should ever have to follow Tracy Parsons, especially with this nerdy stuff, but this is really nerdy. We had not done a major overhaul of the application system since we launched it in 2010. So I just tried to make sure that I covered the things that an agency will discover as early as January 2nd. And just also so that you know what we've been doing. I think you've heard us reference some of these changes and seen mention of them in the staff reports because everyone was involved. And, you know, basically like the overall reasoning was we can make this easier for people to use. And the results are basically like, well, you know, looks fine to us, but it still could be glitchy. And I just want to say we had a DD board member testing some of it. And I think the main thing to keep in mind if you're using this system and something's not working the way it's been described, it might not be you. It's, you know, it could really be that something's wrong and we need to fix it. So anyway, that's all. That's the context.
I thought it was very thorough, the memo. The one thing I was thinking about when I was reading it was you know, it'd be great to have Susan Fowler on the board to go maybe check this out and go through it, because I know she's very good about this kind of thing and going through all the little things that might come up that might make it easier to go through. I know she's very systematic with evaluating things. So
that's interesting. She's one of probably 5 board members who've used the system a lot and not really had problems with it. So it was really interesting to learn from a newer board member who tested some of this and you know, found it wasn't as straightforward as I thought. And then of course, we're also always open to agency feedback because that's who has to use it. And you know, the view that we have of it is a little bit different from the view they have. So I'll tell Susan though, maybe she'll want to do that for us.
yeah, I mean, and you know, people that run all the agencies in town, they come from all different all different, you know, backgrounds. And so their expertise may be different and not everybody is technologically like apt in working, you know, through an application online. They're better with like pen and paper as opposed to going through something on a computer.
Yeah, that's a good point. You might have noticed there were some things that we thought about doing and had to step back. Particularly like simplifying the revenue form was appealing at first, and then we compared with United Way because our structure was based on theirs many years ago, and they matched. And now United Ways is really different, so it just seemed like maybe we need to really consider any further changes to this since they're already different. But Anyway,
All right, are there any questions?
exciting, right? Compared to those summer youth initiatives.
Yeah. If there's no questions, we can go on to section C, which is the selection of a board member to serve on the RFP review team. I don't know if Lynn, if you want to talk about this.
We have the duty board selected a member this morning. The RFP details a committee. It talks about what the committee will do and gives a timeline. So it's a committee of 5 who will review all of the proposals. The proposals are due noon on December 21. I don't really know what to expect. I'm guessing between 0 and 3. If we get so many or they're so long that the review team can't get through them by early February and make recommendations to the boards, then one recommendation the team could make is we need more time. We need to change the timeline. And then we would change the timeline during a board meeting with official, with notice and approval and public input. If there are no proposals and the team is all dressed up and ready to go and we got nothing, then they might advise on a plan B. And I have some ideas for a plan B, but it's the 5 people are the 2 associate directors, Liam Bryson and Kim Vowdry, 1 member of each board. We can't have more than 1 member from a board because then it makes it another public entity and subject to Open Meetings Act, which makes your meetings, it's fine if they're public, but it's a little bit harder to put them together quickly. And then the 5th member is what the RFP called for was either an agency who had worked with the previous team or a member of the previous team. And we actually got the lead researcher from the previous team. Mark Aber has agreed to be on the team. So we just need someone from the mental health board.
I would like to nominate somebody, if that's okay. I would like to nominate Molly McClay.
I will accept being nominated. Would you like me to speak to my interest further? Okay, I see nods. So I am interested in serving on this committee for a few reasons. One, I have experience being on both the agency and practitioner side of evaluation, as well as the research side. I'm a doctoral student at WashU in St. Louis, and a lot of my training in my program has been around doing community-based research. I've taken some classes specifically on survey design and understanding measurement, as well as statistical analysis. And so some of those research specific questions to evaluate the quality of a research team, I feel like I would be equipped to do, as well as thinking about it from the practical consideration of agencies and what their various different constraints and opportunities and things might be around research. In my position at the university in the Women's Resources Center, I conducted a lot of a program evaluation myself on our sexual assault prevention programs, and actually got an opportunity to work with some research teams and facilitated some interesting conversations that were sort of looking at the tensions that can sometimes exist between getting research done in a practical way, evaluating things in a way that will incentivize people to complete the evaluation while also recognizing the need for the robustness of the research process. So I am very interested in this opportunity. I feel it would be a good use of some of my experiences as a way to serve the board in a deeper way.
I am glad it's you.
I guess to make it official, I'll second the nomination.
All right. Are there any other nominations? Seeing none, do we need a roll call, I guess, for this, or? I guess let's do a roll call, just vote to make it official.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
Molly McClay,
I'm gonna awkwardly vote for myself, so yes.
Joe Omosagie,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yeah.
John Paul Yoakim.
Yes. Yay, congratulations. I know
Thank
did
you.
great. All right, so now we're on to old business. So the 3-year plan with the final draft objectives for 2023. So I don't know if Leon wants to talk about this or if Lynn wants to talk about this one.
There aren't a whole lot of changes since the first draft that Leon brought to you in September had a lot of revisions to the objectives because we kind of went deep into it. And then since then, the input that we've gotten actually was from 2 board members. We didn't get any public input or any input from agency stakeholders, even though Leon shared it to them. But the board member input was, it's summarized in that middle paragraph. Actually, a member of the DD board and a member of this board. So those are the only additional revisions to the objectives.
I guess I had one question, comment about one of the changes, which is the goal number 2, objective 2.6. I guess the question is, since we are now, instead of saying under invested populations, and we're specifically calling out, are we, the fact that we don't have sexual orientation listed there, especially if we're talking about public health and we just have the monkeypox, is that something we want to include?
Yeah. Where is that? Sorry if this makes you all dizzy.
It's page 28.
Okay, thank you. What if we said gender or other minority groups? Or if there's if anybody has an elegant way to put this, to add these words, I'd be really happy to hear it. I can't think of it.
You can say, assess the impact of public health threats on I would say sexual I don't want to say sexual orientation.
Yeah, I had no idea how to say it either. But it was just the fact that we specifically say 3, but that's it. I think we want to make sure we don't exclude a group that.
I mean, that's a great point. And that is, I think that is a group of, where we look at data through that regional health plan collaboration, look at the data and especially in disparities in health outcomes. So
There's a suggestion in the chat from Nicole.
thank you, Nicole.
Oh, there we go.
Nicole says gender or sexual minorities. Thank you.
Thank you.
I would second that. I know in some of the research that the phrase gender and sexual minorities is sometimes used to describe certain forms of research as well. So I think that could definitely work and can just be added right in there.
Thank you. Well, that's great. Should I go back to the motion? I don't think anyone made a motion, so you could include this revision in that motion. Are there other revisions that people would like to add? Thank you, Matt.
I think just putting
people at risk in general because these are great subcategories, but as we're learning, not everybody fits into any certain subcategory, and they're certainly at risk. So, sometimes religion's involved, and sometimes cultural practices that don't fall under these blanket terms, and that we're learning to become more and more culturally competent about. And so as long, if we don't have maybe these constructs, we can be more inclusive, but I don't know. That's just as
You could say, gender and sexual minority groups and other minority groups. And this way it's more general at the end.
I guess the one question, since I'm kind of curious, the rationale then, because before it, as I said, it had underinvested populations. And so my thought is, I don't know who's made the suggestion, and maybe they don't clarify, but was it to be more specific? So when we do get these reports, they know exactly, hey, they want to include this, that, and the other. Was that the rationale for specifically calling out instead of using underinvested or something?
Yeah, so there are other populations are described in other parts of this. There are also families who may be under-resourced as a result of a family member being incarcerated. And then rural and farm communities, where, around here, certainly under-resourced. And then those who would appreciate language assistance, language access and communication assistance. There's a bunch of that is covered in other objectives. And then also developing an inclusive network of culturally and linguistically responsive groups, which could address a specific needs. So I don't know if you want to build it out here. Did you like the suggestion of gender and sexual or other minority groups? In objective 2.6. I think the reason for specific focus was that we already know there are some, that there are data here related to those particular groups showing disparities and poor outcomes.
I think I was the person that suggested the gender, wasn't I, Lynn? And it was because there was no mention of gender at all.
Yes.
In the priorities. That's why I got it on the table. So if you want to refine it, that's fine. Just that's why it's an addition, because it wasn't there at all.
It wasn't. So I think do you all feel okay about the suggestions made so far? I think Dr. Joachim, you summarized it.
Yeah, I'm fine changing it to gender and sexual minorities and other minorities, and other minority groups in Champaign County, if people are okay with that wording.
Well, Molly has in the chat and other at-risk populations.
It does kind of make it a little longer and clunkier than the other suggestion. But I was sort of wordsmithing something. I thought I'd just throw it out there. I also added the phrase "and or" in place of "or" to acknowledge intersectionality and how individuals might be holding multiple minority identities.
I think that wording is great. Kind of covers all the bases. So I guess with no other comments, I'll move to motion to approve the proposed 3-year plan for fiscal year 2022 to 2024 with fiscal year 2023 objectives with an addendum. Sorry, trying to unmute everything. With an addendum to objective 2.6. That adds consideration of gender and or sexual minority groups and other at-risk populations in Champaign County.
I will second that motion.
Can we have a roll call, please?
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy, Alexa, Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Alexa McCoy,
Yes.
John Paul Joachim,
Yes. All right. The next item is the final draft of the PY24 allocations priorities.
I'm sorry, I've gotten way too far ahead in the document here. All right. So it is.
Page 36.
Thank you. I just can't, I can't scroll correctly. Okay. Here we go. So I think this is similar. We haven't had a whole lot of input for this since the meeting. And I think during the meeting, I added changes that had been suggested, but now I don't think there's anything added since the last time you've seen it, actually. Maybe just, it was, see this thing under process considerations. This is some language I showed you that a DD board member had suggested, and it's really late in the document, but it was based on them actually, once again, testing the system to see how easy it was to find the documents, and it wasn't. So we changed the language here to change the expectation a little bit, and then also created an archived downloadable documents section so that when you go to look at those downloadable documents, there's not 50 of them. You can actually find things if you want to do that. Yeah. So the motion is at the suggested motion, sorry, is at the very end.
So I know with the update in the system, there was some differences in the question. Was there some differences in the questions? They removed some of the questions. in the new application process? There were some redundancies, I thought.
Yes, yes. There were also just some of the wording was maybe not as accessible and clear as it could have been. I don't know. Sometimes we get really fancy and we don't need to.
So even with some of those changes, it doesn't change the allocation, the decision support criteria that we've had in the past, correct? For our agencies, how we decide funding.
These priorities and criteria are updated every year. So they're different. Is that what you mean? I'm sorry.
Well, because the people are putting in their applications every year, right? And so our decision criteria typically, I don't know, since I've been here, usually is the packet you print out has all the same questions each year, but those are in the system, and so those have changed because some of the redundancies have been removed or some of the wording has changed. So it doesn't change how we make our decision, because even though some of the questions or wording may have changed, the overall content is the same. It's just easier for the agencies to put in the data and the information that we want.
Well, that's what I hope. I mean, I'm going to find out. But yes, thank you. That is exactly right. I hope it's easier, but you're right. We're not looking for anything substantially different. The priority categories are a little bit different, but it's still the same expectations. Just the question.
I just wanted to make that clear. So.
Okay, thank you.
All right. So I will move to motion the CCMHB program year 2024 allocations, priority, and decision support criteria as described in the memorandum. Is there a second?
I'll second it.
And I think I forget, I think we're supposed to have a discussion part. Is there any discussion? All right, seeing none, can we have a roll call?
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Plencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
John Paul Yoakim.
Yes. So the next item on the agenda is the PY 22 utilization summaries for the mental health board funded programs. It's for information only, just a report on the utilization for all programs funded by the mental health board.
And you'll see it again in the annual report.
So, you usually get numbers in the application process. Are these the same numbers? Or are these ones that have been reported after the fact that they've actually served? It seems like that's the case, correct?
Well, they're both. The targets are listed and those come from the application. And sometimes an agency will change their targets, but that has to be done by a contract amendment. And the actuals are listed underneath them. So you can see under each one, it's targets versus actual. And a lot of times what you don't get in this report is every quarter the agencies put, they'll give you some numbers for that quarter and comments about what happened. And sometimes those comments are very important. So there's a lot more information than just this report. This is just kind of a high level. And to be fair, we have struggled for decades with how to have the high level be really compelling, because sometimes the details are really where it's at. Success stories are hidden in the comments. And that's probably more what you want to see. But this kind of is comparing what the amount of money, what the program intended to do, how far it meant to reach, and then the actuals. And up at the top of this document is a link to the outcome reports. It's not linked, but it links you to the page where the performance outcome reports are posted. And that's a very long document that has every agency's outcome reports for the year all combined in one. And the combining of it into one PDF is actually really hard for us. It takes a long time just to put them all together into one document. But that's really interesting. That's where they talk about the outcomes, which also where it's at. And then we threw in a couple charts this year. Did you see charts? Sorry, this is is it making you dizzy for me to scroll through this?
When some of the organizations don't hit their target, treatment plan clients or non-treatment plan clients, do you like follow up with them and ask them what went not as planned or what obstacles there were?
They usually they're usually reporting on that in the comments in their quarterly reports. And also these amounts of money listed here are the original contract amount. We are in the moment where if an agency, for example, there is one among here who was not able to hire the staff person that was sort of the center of it. So they're paying a bunch of money back. So their numbers were low. The reason is that they were not able to find a staff person to run the program to the fullest extent. So they returned the money, but they learned a lot. And I think they have hired somebody. It's a continuing program. So that's also happening now. Like we're making the adjustments to the payment amounts. We're getting overpayments back. And sometimes that has to do with staffing. Sometimes it has to do with agencies receiving other funding to deliver the services. So it takes a while. But yeah, the comments that they provide to us are really interesting, and y'all can look at that stuff if you ever want to. You have access to the online system. It's just not always super convenient. So I can show you how to log in and look at all those reports.
It's interesting to see how some of the organizations like the Well Experience Family Services, how they almost doubled, but they tripled their treatment plan clients of what they had as their goal. And they provide that service with the same amount of funding as we were going to give them, that would give them for just the 50 treatment plan clients. So that's just very interesting to see how they're able to, serve more people than expected, and we're able to, really just, put in all the effort that they could to do that. So it's great to see that.
Yeah. And agencies use these categories a little bit differently. And that's something they describe in the application, but it's not captured here because that would make the document so much longer. But occasionally it's, so like Rosecrans, we have some brief parenthetical comments about what those service definitions are, because they're, it's a little bit different for everybody. So I would say, if you're interested in more information, boy, do we have it. And then we made pie charts for you too. You'll see them again in the annual report.
Yeah, I mean, I think for me, it's looking at both sides, just trying to take lessons for, future agencies, like what agencies could do better if they undershot or had difficulties and obstacles. And then the other thing for those that excelled and outperformed their expectations. What did they do that made them perform better than expected with the finances they received, and how can we replicate that in the future? So, but I really appreciate all the information. Are there any other comments, questions? All right, we can go on to the next section. That's the appropriations charts. Oh, wait, I guess, do we need to do that? Or you already went through that, so.
Sorry.
Yeah, no, that's all right. We can go on to the next section, which is the Expo Coordinators Wrap-Up Report. So, I mean, I thought this was an interesting summary of the event and all of the work that went into the event. And also looking at people's agencies and visitors' responses and recommendations about whether they like the venue, what could be done better, what was done well. It looks like there was some discussion between this place and I think the Vineyard versus another place. I think one person even mentioned a different mall. I can't remember. Obviously, I don't think any place is going to be perfect. It seemed like the majority of people, including agencies and visitors, really liked Marketplace Mall. It seemed like there was a lot of help, even though things didn't go well with the signature events. Marketplace Mall staff really stepped up in helping us out to make this a successful event for the Disability Expo. The one thing I had a question was in the questions of what would you suggest to improve future events on page 76? There was a comment of return to the Vineyard if possible. I think the only question I had was how many people commented saying that versus like Marketplace. And that would be something I would be kind of interested in knowing, just to kind of guide decisions in the future.
It could be the same person who mentioned it in the earlier, it could be just one person mentioning it in a few different places. Or it could be a bunch of people mentioning it. But, you know, the steering committee had a really healthy conversation about that. And like some of the things that are really valuable about the expo are not the expo, but what goes on to make it happen. That steering committee is a really interesting group of people. There are some disability rights advocates who actually have disabilities, and they're very outspoken about what this should be. And they have led it. Some of them have been leadership in that steering committee since the very beginning. And I think that we're lucky. I'm not sure that we have such an active advisory council of people directly affected by these, you know, by the funding. So I like that about it. And some of the steering committee members were uncomfortable being at a church, and they had not said it before. And when there was this opportunity to talk about where they'd like to be, some people said they would really rather be anywhere but a church. So that was a surprise because the Vineyard was beautiful and so easy to work with. So I don't know, the steering committee met just yesterday, I believe. I'm not sure if they talked about that or if they talked about next year. But I could ask if there are data, if they can tell from the data, how many people mentioned a return to the Vineyard.
I mean, as long as they have that data so that when they look at that for next year for their decision-making process, I think that's fine. So I mean, I thought when I was there, I thought it was a great venue. I liked the atmosphere. I thought it was, you know, it was busy, but not too busy, I feel like. You know, it wasn't crowded that you couldn't get around and see everything really easily. I like the lighting because it was pretty, you know, bright the whole time. It was very welcoming. I know the other things that people had said about the marketplace mall, it seemed like there was the two big things was just like the Wi-Fi connection, I think people were saying, and that some people felt it was too busy. I know one of the issues with this year was having a low amount of evaluation responses. So hopefully next year they'll find a way to get more evaluations so that they can make sure they're, evaluating each year and making sure they can make improvements or adjustments as needed. So. Is there any comments or questions? All right, we can move on to page 93, the quarterly reports on the 211 data for Champaign County.
They really know how to do charts. A little bit jealous.
I feel like I'm used to seeing this every year. I don't feel like it changes much, which is good because it means they're doing, like, they know where they're getting and they're doing the right thing. It seems like always the majority of the calls are housing. I know we talked about that in the past, just recently with the study session.
Yep.
And actually, I'm going to interject, and this might be a board to board thing too. I don't know. I recently had a situation where I was trying to help someone who was about to be evicted. And so I sent out a note to several folks saying, help me, how do I help this person? And one of the calls that I made was to 211. And I often tell people who are asking me for money because they're homeless or hungry or whatever, to call 211, they can help. So unfortunately, my experience calling 211 to say, hey, how can I help this lady with housing was, well, she can go to a homeless shelter. And I'm like, okay, that is not the answer I wanted, So I was kind of disappointed, but I will say I didn't get disconnected. I got a person right away, but I just really felt like if I was a person in need, I would have been very discouraged to be like, well, she'll just have to go to a homeless shelter. We don't have any resources. Well, there are resources in our community. So that was kind of and I don't want to be like a negative Nelly here because I think 211 is a great service, but in my time of need, it kind of failed me a little bit. And I had shared that with Lynn one day and she's like, I hate to hear that, but I'm glad that you experienced that so we know things that do need to be worked on.
So they didn't screen and ask questions why you needed housing?
It was actually one of my husband's employees. And so throughout the day, I made lots of calls. And in the end, sadly, we found a solution, but the person didn't want to maybe move to another facility or something like that. So at a certain point, I had the resources, but she was, and I get that. I totally get that. So, but yeah, I just didn't feel like, we asked enough. I wasn't asked enough questions.
There wasn't a good triage.
Correct.
Do we know who triages these calls? Are they social workers, nurses?
No, they're trained to, the foundation, which is 211, has there's an accredited program they have to complete. So, and I think it's unfortunately called AIRS. We have lots of things that are called AIR or AIRS, but it qualifies them to be information and referral specialists, and that's what they do. Now that same service is getting trained in managing crisis calls for 988 as 988 rolls out across the whole state using the 211 provider. of which is PATH. So I think they had to staff up really fast, and they did not hire as many people as they needed. And they got them trained pretty fast, but they're also going to be doing the suicide prevention lifeline. So they're not more specialized than these specialized training models. I mean, it takes a while to finish the training, but they're not licensed professionals. Yeah. Is that a helpful answer?
Yeah, no, it is. It is. I'm just thinking, because usually, even if you have training in answering and triaging calls, whether they're health related or any kind of related, it takes practice, it takes supervision to make sure you're doing it correctly. A lot of times, even in a medical office, even as a nurse, they have books that have algorithms of what to ask, what to tell families. I hope they have something like that at 211.
I think they do. I mean, this is the theory that, so in this community in Champaign County, we have a real focus on case management. We have lots of case managers here, and I believe in the power of case managers, but they had shared frustration traditionally about 211 because you couldn't access the information very easily. There's an online database, but it's very difficult to navigate. So you might remember we had a project with one of the U of I, it was U of I Community Data Clinic research team to develop an online version of this, and it worked. It was very easy to use. That was really on behalf of Champaign County users, where we have police and case managers trying to help people. They don't need to go through the helpful guy on the phone, but the theory behind 211 and even 988 is that having a person to talk to on the phone can itself help to bring people, get people through a crisis, can de-escalate enough. So that's what the whole 988 implementation is kind of riding on, that if we can get nice people helping us on the other end of the phone, that we might not need so much crisis care. I don't know how it's going to work out. And we also do need to accommodate different kinds of users, people who don't make phone calls. They'd rather text. So, I think they're trying to do that too, but the theory is that helper knows how to talk to you on the phone and get you to the resources. So anyway, I still like case managers.
Well, I'm sorry you had that experience, Shane. I hope there's someone listening to this, and hopefully they look like someone from United Way listening to this, and hopefully they make improvements, or hopefully this is, if it was a one-off, that it's not what normally happens when they triage calls. But if it is, then I hope that they make changes.
But I will say personally, and like I said, I spent a bit of time trying to help this woman. And a couple people I talked to, I shared how frustrated I was. I was like, I'm a pretty vocal person. I'm pretty articulate, semi-educated, and I just kept feeling like I was running into brick walls and stuff. And so then ultimately I did, at the end of the day, I sent Lynn a note and I said, I've done all this and experienced these things, and now she doesn't really want to make a change. And it ended up, her building was condemned. I was told by the city she could still stay there. It just has no heat. So that's why they condemned the building. But at that point, I'm like, well, doesn't the landlord have to pay for her to go to a hotel? Well, that has to go through the court system, and, just all this. And so I just was like, wow, and I hate that I had to experience it, but I'm thankful I experienced it. Because wow, it's tough out there for these folks. So.
And the other thing I would recommend is, if they do have a doctor, calling the doctor's office, because they have a social worker that can also provide them with resources. Oftentimes we get calls to write letters for like medical necessity, to keep the power on or to keep the water on, things like that. But if they're having issues with like paying their bill, because it doesn't wipe away their bill. So if they need assistance, we usually will put a consult in with our social worker who will reach out to them and help them with that. So, I mean, the doctor's office is a good way to get in touch with a social worker if they're having issues. All right. Any other comments about the 211 report? All right, seeing none, I guess we can go to the schedules and allocations process timeline. So I know we have the tentative.
Lynn, you're muted
for-
there.
I'm sorry. Go ahead, John. I'm
I
sorry.
don't go ahead. You can go. I was just gonna say with the tentative meeting for next month, but you can talk about that.
The main thing about that date is that I need to be here at 5:30 that day to read any proposals, read any proposals into the record, like onto a Zoom recording and in this room in case any member of the public comes in. That does not mean any of you need to join me. So if you don't have a meeting, it's totally okay. And I'll make sure that it's listed as the 5:30 RFP proposal opening, and that's it. But you don't have to decide right now. But I do want to show this classy way that so the DD board did cancel their December meeting. Here's the classy way that I do you ever check things off the checklist, like put an X through the day on the calendar. I felt so negative doing this, but just to show that we are almost done with that allocation timeline. We are now moving into the timeline for PY24 funding and 2023 meetings. So you won't see this puppy again. Yeah, that's all I got. If you know you don't want to have a meeting on December 21, we can cancel it. But if you want to just leave it tentative for now, we can decide later.
Was there anything else we needed to cover for the next meeting? I don't think so. So I think we can cancel the meeting. Do I need to vote on it, or can I just say that as a president? Okay, so I will just cancel the meeting for December 21st.
Sounds good to me.
And then anyone who wants to come in and watch me open the RFP proposals, come on down. Okay.
All right, we'll move on to agency input. Is there any agencies that would like to make any comments today? All right, seeing none, we'll move on to the CCDDB input. Is there any input from the DD board?
They met this morning. They also approved priorities for the PY24 period. So we've already got those all posted, and we'll go as quickly as we can to post these priorities too. They approved a 3-year plan with the new objectives. So this one change that y'all added isn't going to take me any time at all to incorporate. So we'll post that really quickly too. Otherwise, they had a very robust discussion about something I'm sure you've all seen in the news over and over again, and that's the scandal at the Choate Developmental Center in Southern Illinois, and just it's kind of a rallying cry for, like, let's seriously help Illinois move away from institutional care and take community-based DD care more seriously. Finally, I think we continue to be one of the bottom 3 or 4 states when you ranked by investment in community-based DD services, like steadily at the bottom. And that's because we pour so much money into institutional care, and it's just not going very well. So that was a surprise. It was an addition to the agenda, and it was a very lively conversation. Some folks here provided really important input at that too. So that was what they did. They also liked that expo report. And anyway, they were going to send emails of thank you to the Boots who put the report together and who put the expo together. I think that's it.
Thanks, Lynn. So the next item is the staff reports.
Dr. King, this is Chandra. I just wanted to make sure that I reminded you that the second quarter reports, there was a request to start looking at board demographics from the DD board. And so I've created a way to just begin to ask people to kind of self-report where they would fit. You do not have to put or it's not identifying information. It's more so just seeing who is on your board and how they're represented. A lot of people talk about diversifying boards, but only look at race, ethnicity, and gender. And so this is a way that you can look at it in a much more broader way.
So this change to the second quarter CLC report has been made and it's posted. So the agencies will be doing second quarter reports. They're due at the end of January, so they'll be doing them pretty soon. So it's good that this is in the board packet and people can see just collecting data on board members. So
this is nice because you can just visualize it very simply.
Thank you, Chandra.
Yeah,
I
thank you.
think that's very fascinating. And I think, you know, I guess I'm just assuming how some of this is going to turn out, but it might even make some of the groups realize how their boards don't have much diversity, even though you sit across people on a Zoom call or in a round table or whatever. Sometimes when it's in black and white, you realize your lack of diversity. So.
And then also not just, okay, the lack of, and also looking at ways of how can we strengthen it? Because all of the people are represented in our community. And so it's just a matter of, you know, doing some things non-traditionally, making sure that, you know, we just do things differently.
Yeah, and it kind of helps the boards realize what their strengths are, what weaknesses they may have, gaps they may have, things like that. All right. Any other comments, questions? All right. Seeing none, are there any board-to-board reports? I know I'm gonna go to the Promise Healthcare one next week, so I'll have that for, I guess, January's meeting. Is there any board announcements? All right. Seeing no board announcements, I guess I'll move to adjourn and say happy Thanksgiving and happy holidays, happy New Year. I guess we'll see everybody next year.
Yeah, happy Kwanzaa.
Yeah, Kwanzaa, yeah.
Hey, have a good one. Take care.
All right.
Thank you all.
Thank you,
Bye,
everybody.
everyone.
Thank you, guys. Bye.